Good day, I am Chemberllie and I will be presenting the health disparities. Learning outcomes. At the end of this lesson, learners will be able to define health disparities, identify examples of health disparities in terms of quality of care and access to care, identify causes of health disparities. Lastly, identify efforts made to address the problem. What are health disparities? Health disparities refers to the differences or inequalities experienced by one population in comparison to other population due to certain factors like race or ethnicity, socioeconomic status, education, geographic location, age, disabilities, religion, gender, or sexual orientation. Another definition provided by the U.S. government defines health disparity as a particular type of health difference that is closely linked with social or economic disadvantage. All people, regardless of race or other differences, have the right to have a quality care. However, the National Healthcare Disparities Report of 2011 shows that in the United States alone, some people receive inferior care compared to others. To add, 2012 report demonstrates that although healthcare quality and access are substandard for some groups, and the quality of care is continuously improving throughout time, healthcare access and health disparities are not moving. What to know more about health disparities? Health disparities apparently can last for generations, and this is perpetuated by discrimination and income quality. Differences in health is linked to social or economic disadvantages. Apparently, to close the gap of this health issue, it requires to address the social determinants of health. So, health disparity in simple terms refers to a disproportionate number of health conditions and deaths compared with the general population. For instance, African Americans make up 13% of the U.S. population. However, they represent almost half of all new HIV cases despite their low number of population. What are other examples of health disparities in terms of quality of care? Adults ages 65 and above receive poor quality of health care compared to adults ages 18 to 44 for 39% of measures. Another one is colored people receive terrible care compared to white people, measuring 41%. Another example is Asians, American Indians, and Alaska Natives receive worse health care in comparison to white people for about 30% measures. Hispanic received inferior health care than non-Hispanic whites for 30% measures. And poor people receive poor quality health care compared to people with high income, measuring for 47%. In access to care, not everyone receives the same treatment. Hispanic patients were half as likely to be given pain medication when they went to the emergency room with a broken bone. There are also health disparities in mental health treatment due to race. Example of this is 31% of white children with mental health problems receive mental health services. However, only 13% of children from diverse racial and ethnic backgrounds with mental health problems receive mental health services. Moreover, gaps in access to healthcare includes Hispanic adults were more than 2 times as likely as white adults to say they went without seeing a doctor in the past 12 months because of hospital costs. Other examples of health disparities and inequalities to access to healthcare includes colored people had worse access to care in comparison to white people for 32% of measures. Asians are given poor access to healthcare than white people for 17% of measures. American Indians and Alaska Natives received worse access to healthcare than non-Hispanic whites for 63% of measures. And poor people had inferior access to healthcare than people with high income for 89% of measures. The Centers for Disease Control and Prevention National Center for HIV or AIDS, viral hepatitis, STD, and fever prevention shows or presents the data a figure about HIV or AIDS diagnosis and death rate per 100,000 among teens and adults by race or ethnicity, which apparently includes individuals ages 13 and older. The figure shows that the white people in HIV diagnosis rate for 2016 has the lowest rate, and the Hispanic people, which is represented by the neutral color blue, has the highest diagnosis rate for 2016. But in HIV death rate, the white people have a total of 3 individuals who have passed away due to HIV, and the Hispanic ethnic has 21 people who have passed away for 2015. In Connecticut Foundation, babies born to colored mothers are more than 4 times as likely to die before their first birthday in comparison to babies born to white mothers. To add, black or colored adults are more than 2 times as likely as whites to have diabetes in Connecticut. And deaths from diabetes per 100,000 people shows that colored people have higher rates or higher death rates compared to white people. In Connecticut, colored residents are more than twice as likely to die from diabetes comparison to white people. Connecticut Health presents a data for health disparities regarding to deaths from prostate cancer per 100,000 of people, in which the figure shows that colored people are more likely to die from prostate cancer in comparison to Hispanic and white people. And infant mortality per 100,000 birth shows that babies born to colored women in Connecticut die at a much higher rate comparison to babies born to white or Hispanic women. Now, you may wonder, what are the causes of health disparities? To answer that question, there are various causes of the occurrence of the health issue. Many of the underlying factors are caused by interrelated elements that impacted individuals throughout the years. And these factors can be categorized under the 4 categories of determinants of health. This is according to the National Partnership for Action to End Health Disparities, year 2011. The first determinants of health is the social determinants of health. These include gender, socioeconomic status, employment status, educational attainment, food security status, availability of housing and transportation, racism, and health system access and quality. The social determinants of health is categorized into 6 sections: the education, access, and quality, healthcare and quality, food, neighborhood and built environment, social and community context, and economic stability. In economic stability, these include employment, income, expenses, debt, medical bills, and support. In neighborhood and physical environment, these include housing, transportation, safety, parks, playgrounds, and walkability. For education, these include literacy, language, early childhood education, vocational training, and higher education. For food, hunger, access to healthy options. In community and social contexts, these include social integration, support systems, community engagement, and discrimination. In healthcare system, includes health coverage, provider availability, provider linguistic and cultural competency, and quality of care. So what are the health outcomes of these social determinants? The health outcomes include mortality, morbidity, life expectancy, healthcare expenditures, health status, and functional limitations. The second determinants of health is behavioral determinants of health, which include patterns of overweight and obesity, exercise norms, and use of illicit drugs, tobacco, or alcohol. The third one is environmental determinants of health. These determinants of health include lead exposure, asthma triggers, workplace safety factors, and unsafe or polluted living conditions. The last one is biological and genetic determinants of health. These include family history of heart diseases and inherited conditions such as hemophilia and cystic fibrosis. Now, the question would be, are there attempts or are there efforts made to address this growing problem? Yes, there is. So, disparities exist with socioeconomic status, and attempts to address this issue is centered on achieving health equity. This is the highest possible standard of healthcare for all people, particularly those at greater risk for poor health. This is according to Braveman 2014. And only through training can providers begin to recognize and change the discriminatory practices that perpetuate health disparities. And evidences of increased emphasis on providing culturally appropriate healthcare is presented in the following list of efforts or attempts to address the crucial problem of health disparities. I'm going to introduce a few efforts made, and the first one would be the National Partnership for Action to End Health Disparities, or NPA, was established, which seeks to mobilize a nationwide, comprehensive, community-driven, and sustained approach in combating health disparities and moving the nation in order to achieve health equity. So, the NPA aims to increase the effectivity of programs that aims to target the elimination of health disparities through the coordination of partners, leaders, and stakeholders. So, that is the first effort made to address this problem. The same group, or the NPA, released a national stakeholder strategy for achieving health equity in year 2011. This is a similar set of goals and objectives for public and private sectors, initiatives, and partnerships in order to help racial and ethnic minorities, including other undeserved groups, reach their full health potential. Another attempt made is the USDHHS 2011 HHS Action Plan to reduce racial and ethnic health disparities was written in order to operationalize the National Strategy and the Affordable Care Act. And then the Office of Minority Health, that was established in 1986, was reauthorized in 2010, that seeks to provide health improvement and protection to racial and ethnic minority populations through the development of health policies and programs that will eliminate health disparities. So, how important is the Affordable Care Act, or how it would make a difference in addressing the health disparities? For instance, a couple with job-based insurance has a child with congenital heart defect. So, under the Affordable Care Act, with no annual or lifetime limits on coverage, the couple or no one has to worry that the cost of their care will outstrip their coverage. Now, if the Affordable Care Act is repealed, annual and lifetime limits on coverage will threaten financial security and access to care for people with serious illnesses. Another situation include a new grandmother on Medicare is at risk for diabetes. So how would the Affordable Care Act would help in addressing the health disparity? So under the Affordable Care Act, there is a free annual wellness visits available to help this grandmother or to help other people stay healthy, and medicine costs people less because the Medicare do not hole is closing. Now, if the Affordable Care Act is repealed, co-payments are required for annual visits, and people will pay more for medications like insulin because of the Medicare do not hole. Another situation that stresses how Affordable Care Act had made a difference in addressing the health disparities. This is a woman with a family history of breast cancer is planning to start a family. Under the Affordable Care Act, healthcare coverage includes free breast cancer testing, free mammograms as appropriate, and a yearly physical at no cost. Now, if the Affordable Care Act is repealed, family history of cancer can lead to exorbitant premiums or full denial of coverage.